ladies and gentlemen, welcome back again to Green Monday TV and to the AGA Health Talk Show, which is running which we hold every Monday, 6 p.m. to 7 p.m. We thank you, our viewers, for always being here waiting for this program, but also thank you for those of you who have been to our YouTube page, AGA Uganda, and you're able to follow what we are saying. Subscribe, and let us see how we can continuously grow this baby born out of this program and TV show at Green Monday TV. And like we said, we are still looking for sponsors for this program on this TV talk show. It is very important and it has a listenership that is wide, and we would like to see if we can have it consistently aired on Green Monday TV and supporting us to be able to come and provide you information on health. The last week when we were here, we talked about issues of the assisted medical reproductive therapy, the law that is coming into place, and also informed you that on 7th of April it was World Health Day. So we are also continuing to follow up that since this is the health month, and we would like to talk about polypharmacy. I don't know if many of us have heard about what we call polypharmacy, but polypharmacy is the situation where we are using multiple drugs at the same time, especially among the adults. We continuously see that as we age, we have various and different types of illnesses affecting older persons. For instance, you could be having HIV, you could be having also high blood pressure or low blood pressure, you could be having diabetes, you could be having malaria, you could be having cancer, and so for all these, you are taking medication at the same time. But we have not gone ahead to find out how do these drugs interact. Many times, even when we go to the hospital, we don't even tell the doctor that we are already taking other drugs. And so that the person who is going to prescribe drugs is going to give you drugs that work well with the drugs you are already taking. So oftentimes also we are fond of taking food supplements, which are in form of capsules or powder. We are fond of taking herbs. If we are having a disease like HIV, I do know that a number of us have been told that ARVs may not work, that we also need to supplement with herbs. But how are you taking these herbs together with the ARVs? Then those of us who are having blood pressure, diabetes, we have been told that there are people who can provide for us herbal medication. But as we are taking herbal medication, we are also taking biomedicine. And we have those tablets for blood pressure, we are also taking herbs, we are also taking other medication maybe for headache. So, how do they interact? Do we ever even inform the doctor? Also for cancer, if you look in your neighborhood or even in your family, for those of us who have nursed cancer patients, you are having chemotherapy, or you have some painkillers, or you have some other diseases, maybe for ulcers. You have those medicines for bowel control or easing constipation, but you are also bringing different types of herbs. Oh, these people with health products are always saying we can heal this and we can heal that. We just continuously buy and feed our patients. So, what are the likely implications? First of all, you are trying to heal yourself, yes, with various medications to treat the various conditions that you have, or to treat that one condition, but you are using various medications people have told you. They told you, are you on chemotherapy, you are taking other herbal medicines, you are taking tablets, you are taking all these are going to the same liver, to the same person. Do you ever consider what the side effects of this combination are to your body? Sometimes because the patient is very desperate, is in so much pain, you say let us bring everything. In fact, sometimes even what cures us we don't know. So do we ever even know what the implications of these drugs can be? The fact is that when we take multiple drugs at the same time, or multiple drugs for multiple diseases and illnesses and complications at the same time, we are likely to develop even worse complications to the diseases we are suffering from. For example, the first thing that is a disadvantage is the pill burden. You have to swallow and drink medicines all through the day. That alone is stressful. The patient may not refuse, but it becomes so difficult for the patient to even have a mindset to heal with all those pills, with all those drugs and concoctions they are taking at the same time. The second issue is the side effects of the combination of these medications. And we know that all medications have side effects. When taken singly, they already have side effects. But now you are having 5 drugs at the same time being taken. So the 5 side effects of each drug, they combine. What do you think they will bring for us? The second is that they will cause a lot of toxicity in the body. And when the body is closed with toxins, you become frail. Sometimes people are not getting complications from that disease they are suffering from, but they are getting complications from complications from the side effects of the combined medications they are taking. And therefore, sometimes people are going to be even more sick. People who are moving, they are going to be frail. People who are eating, the appetite will go. We shall see that people are now starting to fall. People who are walking steadily, they will start to be frail and fall, fracture. But the worst case scenario is that you can have over toxicity and the person dies. So it's also one cause of mortality, which we are yet to study in Uganda. In developed countries, they have seen this and they are managing it. But us here in Uganda and in developing countries, how are we managing toxicity? And the other issue that we have is that many times when we are sick, you have pressure, you just go to a clinic. You have diabetes, you go to a clinic. You have any other pain in the body, you rush to the clinic, and they are busy giving you medication. Because to the drug shops. The drug shops and the pharmacies will just tell you what they think, but none of them don't even ask you, do you have any other medication you are taking? Because if you came from that background of knowledge of the other medication that exists, that would be helpful. But we don't even get that background to this. So we are left in dilemma to face the side effects of the multiple side effects of the multiple drugs we are taking, which are a complication in our patients' lives or in our lives ourselves. And this is not only for those who are having chronic illnesses, even those who are walking, we are taking very many pills. For instance, I could be taking ARVs, I could be taking medicine for maybe a deficiency in the body, I could be taking herbs. What are the implications of this? And these mainly affect the liver. So when the liver is overworked, it will break down, and it is the source of life, because it purifies all what we eat and allows it to get distributed in simple and healthy particles. But when you clog it with all these drugs, it gets overwhelmed, because we are giving it a big task it can't manage. But also that these medicines are meeting in that liver and fighting each other, or against each other, working against each other, that even the treatment you are seeking to get, you are not going to get. If you are lucky, you treat one and the others will continue to persist. So what can we do? How are we able to go to, how can we avoid these side effects of polypharmacy? And we say that polypharmacy is the multiple illnesses at the same time. And we said that this is very common, polypharmacy is very common among people with chronic illnesses, but also for people who are aging, or who are older, who are at risk of having many complications and diseases. So sometimes even the diseases of the old, one brings another. For instance, you realize that when people have cancer, sometimes the pressure, the blood pressure also gets disturbed. And then sometimes the blood sugar gets disturbed. So you are forced to take the various medications at the same time. So the doctors, if you are with the same medical doctor for this disease that came first, and they know that you are developing other diseases, most likely they are going to give you medication that does not contraindicate the other. So it is important that when you go to the hospitals, ladies and gentlemen who are watching me, that when you go to the health facility, to the hospital, tell them I'm already taking medicine for blood pressure, to stabilize blood pressure. I'm already taking medicine for kidney. I'm already taking medicine for cancer. I'm already taking medicine for diabetes, so that the doctor or the person who is prescribing for you any medication, whether at the clinic or at the pharmacy, understands that what you need is a medicine that is compatible with that medication that you are already taking. And let us avoid just going over the counter asking for medication. I need this medication. We have become our own doctors, and that is one of the reasons we are continuously seeing sickness, morbidity, and mortality, because we don't even know what is killing us. The medications we are picking over the counter without prescription. In other countries, you cannot get medication without prescription. Just even across here in Rwanda, you cannot just go to the pharmacy and you buy medication. I think also our government is to blame, because we have regulation that we never put into practice. We have very good regulations, policies and guidelines, but they are never followed. If the government was serious and so loved its people, it would make sure that everyone gets a prescription before going to the pharmacy or the drug shop to buy medication. Because we have seen it is through polypharmacy that some people are going to have adverse disease events without their knowledge. They think they are treating themselves by going to the counter and the pharmacy and buying a drug, but it's detrimental to buy drugs without first getting to know what the disease is and what particular medicine we need. And I think we are all culprits. I think I'm also a culprit, but I don't like drugs, so I keep all the time trying as much as possible to consult before I buy or take any other drug. And if I have to take both medicines at the same time, I often give myself a difference of several hours. We realize that you need to take various medications for the various disease conditions and illnesses at the same time. And like I have said, I am also a culprit. I have multiple diseases, and therefore I take many medications at the same time. And so the one thing that comes to me is that I abhor and I don't like and loathe the multiple pills that I have to take. But because I must, I have to make sure that I distribute my pills during the day to ensure that they don't interact. So if I'm taking my ARVs at night, I make sure that I take the other supplements in the morning. Or if I'm taking the ARVs at 9, then I take the supplements at 7, so that I have 2 hours of absorption before the other one comes in. And if I'm to do herbs, I don't take them at the same time as I do the pills or the other medications that I'm taking. I make sure if I'm to do herbs, I do them during the day, when I have already swallowed the other pills in the morning and also the other ones that I take in the night before I go to sleep. So it is important that we apportion these drugs so that they don't interact. So like we are saying, the interaction of these multiple drugs has adverse effects, and they could harm you as a person. They can hurt your liver, because the liver gets overwhelmed by processing so many things at the same time if you are swallowing very many medications at the same time. And so what can result out of this combination of the multitude of drugs you are taking at the same time is that they can have multiple side effects. Like each medication has side effects. I'm re-emphasizing. Each medication, even the one with the least side effects is aspirin. Every other medication has bad side effects. But what we look out for in medication is that component that heals us. So the side effects are negligible because you are treating. So you can even deal with them over time. But when you are taking so many drugs at the same time, it means you are going to have these medicines interact. At the same time, the diseases are interacting, and you see how much havoc they are causing. So it's important that when you go to the health facility, or to that drug shop, or to that pharmacy, or to that hospital, tell them you already have another disease for which you are taking medication. It's important that we disclose that I'm already taking this kind of family planning pills or contraceptives, I'm taking ARVs, or I'm on ARVs and I need contraception. But you know that there are some contraceptions that are contraindicated for ARVs, that you cannot take them together. That if you take some family planning pills, they will stop the action of the ARVs. So it's important that doctor knows that if you are taking this other drug, it will stop the other one from acting. So you might be treating the other one that's failing the medication that you already have. So it is important that when you go to the health facility, viewers, if you are still there and watching and listening intently, that when you go to the health facility, you are already taking medication. If you are an older person, or if you are a person with a chronic illness like HIV, like high blood pressure, like cardiovascular disease, if you have diabetes, if you have osteoporosis, that's the disease of the bone, if you have mental illness, and you are consistently on medicine, you must live on medication. So whenever you go to the hospital, tell them that you are already taking medication for another ailment, so they are able to know which medication goes well with the medication you want, because you don't want complications or to inactivate the medication you are already taking. And like I said, many of us in the developing world, in Africa and in Uganda here, we love herbs. You are taking biomedicine, but you also want to add on the herbs. So how would you take them? Make sure that you don't mix them. When you are taking your pills for other diseases, diabetes and whatever, make sure that if you are taking herbs, you take them in the morning. And please desist from getting off those pills you are taking. Whether you are getting herbs to stop HIV, please drink those herbs in the morning and take your ARVs at night. Don't mix them, because you don't know what the potential side effects can be. We have seen that sometimes the side effects can even make you disabled, they can make you weak. The side effects can weaken you, because remember it's a combination of 5 drug side effects. So how strong are you? It's soccer. First of all, you are maybe not able to eat well to be able to flush out the toxins. Maybe you are not able to drink enough so that you flush out the toxins. So you are better and safe ensuring that you tell the doctor what you are suffering from, what medications you are already taking, so that the doctor gives you the right medication. So the other thing is that sometimes you continuously get hospital admissions. Because of this multitude of medications and their side effects, you are likely to be falling sick, weakening and going back to hospital, and bringing a lot of burden to the people who are caring for you, and even increasing the bills for the family, but also spending time with the health worker who could also be working on another. So if we disclosed our issues early, I know people fear talk about HIV, they fear talk about the syphilis or other diseases they are suffering from, the TB. Please tell the doctor what you are suffering from, because in the confines of that room, there is confidentiality and privacy. The doctors have sworn to promote and protect confidentiality and patient privacy. So whenever you go to the doctor, tell them whatever you are suffering from. They will give you your secret, and they will give you the right medication to ensure that you don't be sick. But on the higher level of negatives, if you do these medications and you are taking them consistently together, you are likely to die out of the side effects. The disease, but also gets complicated because of the side effects, and then you die and people think you have died of a disease, when actually you are dying of the side side effects of the medications you are taking, because we are continuously seeing complications from side effects as reported from the Western world, that sometimes the side effects become more complicated and they actually kill the person you are trying to treat with all these treatments. I have a friend who died, and then the son told me, I think Daddy did not die because of the chemotherapy or the cancer, but he died because of polypharmacy. And I was surprised that this gentleman, Henry, was even able to understand that there are also those consequences. Very few people understand what polypharmacy is. And it's high time we started discussing it. We started discussing it within our pharmacies, within our drug shops, within our homes. You are seated before your TV and you are taking multiple medications at the same time. Please go and find out, do they have contraindications if you take this drug and the other one at the same time? Do they have implications? So it's important that wherever we are, even within the clinics and the hospitals, let us inform people, the health providers, that you're already taking other medication, so that they are able to help you, give you the medications which works together very well. And like I said, if you must take all these medications, don't mix them. If it is for HIV, swallow those at the same time. If it is for diabetes, swallow those at a different hour, like 4 hours difference. If you also have for high blood pressure, swallow at another 4 hours difference, so that you continuously make sure that the liver is able to digest and absorb the medication in those 4 hours before you bring in and introduce another. Because these medications are so complicated, they actually wear out the kidney. And please, as you take these multiple medications, do a lot of greens if you can afford them, vegetables, fruits, and if you can, also drink lots of water. It's encouraged that people of weight of like 50 kilograms or maybe 70 pounds, please drink 2 liters minimum of water. And those of you who are still able to walk and also taking all these multiple medications, do exercise. Drill, sweating helps to ease the toxins and it helps the body to absorb the medication very well. So it's important, ladies and gentlemen, that we continuously observe our health. And remember, the World Health Day for this month, which was commemorated on 7th day, and for this month to say is my health, my right. So we are saying, even when your health is your right, you have a responsibility to protect your health. And you have a right to take that medication for all the diseases you are suffering from. But you also have the responsibility to ensure that you don't suffer polypharmacy or the adverse effects of taking multiple drugs for multiple diseases at the same time. It's important that we start to observe this. When you go to the health facility, please tell the health provider. If you go to the pharmacy, tell the pharmacist. If you go to the drug shops, tell the dispenser that you have other medications you are taking, and please know your medication, so that when you reach the hospital, you tell the doctor what medications you are taking. If you are taking medicine for pressure, medicine for diabetes, know the names. If you are taking medicine for TB, know the names, so that when you reach the health facility, you are able to tell the doctor that I'm already taking this medication, and this other medication you are giving me, does it have issues or complications if it is taken at the same time or within the same body of the patient. It's important that also we try to change our attitude of going to the dispensary, to the dispensers in the drug shops and the pharmacies, and we ask for medication even before we are tested or we don't have a prescription. Because like I said, when you tell the health provider what you are suffering from, the different diseases you are suffering from, and the different medicines you are taking, then the doctor is also able to make a choice and make your health your right through giving you informed choice. Because you can only make the right decisions for our health if we have the right information. And the doctor can only serve you your right if they have the right information. And the doctor works from the history you give them. The doctor does not come and check you, apart from going to the lab or even measuring pressure. they also depend, their medication and diagnosis is dependent on the history you give them. And part of the medical history you need to give is the other medications you are taking. But also for you, the health worker who is watching, do you ever ask people when you are diagnosing or they are in a clinic whether they have other medications they are taking before you prescribe? Because it should be now on our mouths for those with chronic illnesses and those who are aging, that the doctors understand that aging is something different, it's not the usual for the young ones. Ask us, do you have another disease? Are you taking other medication? If so, what kind of medication are you taking? So that we are able to make informed decisions, but also you are able to make informed decisions and make our health and our rights into action. Because we cannot consistently come to you and you just ask us what we are suffering from and give us medicine without knowing the history of our diseases, whether we are taking several medications or whether we are taking one. So following the International World's Day this year, My Health, My Responsibility, I implore you, ladies and gentlemen, to start going to health facilities, get prescriptions, but prescriptions should be based on the history of your disease and the medications you are taking, so that the doctor is able to give you medication that is safe and that does not bring complications to your body. With that, I want to say thank you for watching us and viewing us. Go like our YouTube page, AGA YouTube, and also continuously tune in Green Monday TV. I am Flavia Chomkama, Executive Director, Action Group for Health, Human Rights and HIV, and we are based in Kagoma, next to Pau Primary School. Find us there. We talk about health, we discuss health financing, and we talk more about how to be accountable as health systems, but also how to be accountable as responsible patients. My health, my responsibility, God and my country. Good evening.